Dear students, today we are going to learn about depression. Do you know what depression is? Do you know why it is important to learn about depression? We all know that in today's fast-paced work and social environment, men and women who work outside their homes undergo a lot of stress because of the cutthroat competition at the workplace. Once they come home, another stress-related environment takes over. In these circumstances, it is possible that people get stressed out. People who are unable to cope become depressed and experience a complete breakdown. Today we shall talk about depression. Can you tell me what you understand by the term depression? Yes, it is a medical condition where the affected person does not even realize he is suffering from depression. He or she loses all interest in day-to-day activities, becomes irritable, lethargic, and begins to think about death and suicide. The depressed person isolates himself from family and friends. There are many forms of depression, and factors that are responsible for this condition are varied. Today we shall discuss in detail the various forms, causes, and remedies included in the diagnosis and treatment of this mental illness. So students, let us together learn about depression. The first section deals with general concepts related to depression. The second section deals with signs and symptoms of depression. The third section deals with forms of depression, while the fourth section deals with causes of depression. Finally, the fifth section deals with remedies for depression. Depression and its concepts. Now we shall talk about depression, a term very commonly used today in a highly competitive, stressful world. So how often do we hear people say, "Oh, I'm so unhappy," or "I'm feeling low and depressed"? Why or what brings about this negative feeling? Can you tell me what exactly comes to your mind when you hear this common complaint, "I am depressed"? Yes, an unhappy person. Depression is used to explain a particular feeling or mood on specific days or in a particular situation. These feelings undergo a change when there is a change in circumstances. You know, some people find it difficult to understand why a particular person is feeling depressed or low, especially when used in reference to its clinical sense. Some feelings of depression may be moderate or some severe, and it affects a person in his day-to-day life. With respect to relationships and his ability to perform, enjoy life, and experience oneself, it has a short duration sometimes, or at other times the duration is longer, depending on the intensity of the feeling. Okay, so now that most of you have a fair idea about what depression is a common mental disorder that manifests itself with loss of interest or pleasure, low energy, low self-esteem, disturbed sleep, and a disinterest in performing day-to-day activities. The feeling of depression is often accompanied by symptoms of anxiety. Sometimes, depression can become severe and also lead to suicide. There are many variations in depression that can affect a person and is more commonly seen in people who may have a history of maniac disorders. How do we know if a person is experiencing depression? This is possible only with the help of a trained professional. However, most of us have noticed changes in the affected person's mood, behavior, energy levels, or personality. Depression may be a reason for these changes in behavior. It is important that we recognize these symptoms and help the person overcome the feeling of depression. We should not ignore the symptoms we have noticed or assume that they will just go away. There should be no delay in getting assistance at once to the affected person. We should also be aware that each patient is different and the symptoms may vary from person to person. The changes brought by this condition are more apparent to people close to the affected person. We should not underestimate the extent of the disability of the affected person to relate to others and participate in daily activities. The person may appear quiet and withdrawn. There are some people who, over a long period of time, try to put on a mask to appear lighter, brighter, and positive than they actually feel inside. They fear that they may be rejected by the others if they show their real identity, which also makes it difficult for them to ask for help and support. Signs and symptoms of depression. Now let us take a look at the signs and symptoms of depression. Do you know that depression is experienced in various forms by different individuals? It is usually described as a blackout, heaviness, and a feeling of loneliness. The person may feel that he is going to die and may be hesitant to face the world outside. When a person is feeling depressed, he or she will not see any positive aspects in life. The affected person may not feel any pleasure or satisfaction even in the activities he or she would earlier perform with enthusiasm. This leads to a feeling of isolation from others, with whom the person may have performed the same activities and enjoyed them before. In certain severe cases, the above-mentioned feelings may lead to a loss of the will to live and feelings of suicide emerge. Depression manifests itself in many forms, namely physical, psychological, and emotional. As we all know, a person who is feeling depressed may feel numb and empty, hopeless and helpless, with low energy, lack of self-confidence, low self-esteem, lack of interest in sexual acts, withdrawal from other people, changes in sleeping patterns, no appetite, lack of concentration, excessive negative thoughts, harming one's own body, and also suicidal tendencies. A person who is diagnosed with clinical depression will usually have 5 or more of the above-mentioned symptoms. They have an unusually sad or irritated mood. There is loss of interest in even enjoyable activities. The person will be lethargic and listless. They usually have feelings of being worthless and talk about death many a times. They have difficulty in concentration and matters of decision making. The depressed person will have difficulty in sleeping or sometimes even sleep too much. There is a noticeable change in eating habits and visible loss of weight. Forms of depression. We have so far discussed what depression is. Now we shall talk about the different forms of depression. The first form of depression we are going to discuss is called major depression disorder. This form of disorder is characterized by a combination of symptoms which affect a person's ability to work, sleep, study, eat, and so on. Major depressive disorder is a condition which prevents a person from performing normal functions. Many people suffer from this disorder all their lives, but some people may have only one episode in their entire life. The second type of depression is called dysthenic disorder. This can prevent normal functioning, though these symptoms may not be very severe. People suffering from this sort of disorder may experience one or more episodes of this during their lifetime. The third form of depression is minor depression. This is characterized by showing certain symptoms which last for 2 weeks or more. If left untreated though, there is a high risk of the affliction leading to major depressive disorder. The fourth form of depression is called psychotic depression. This type of depression is said to occur in people with severe depression along with psychosis. They have delusions or disturbing vision. They also see and hear things that others cannot hear or see. This is also called hallucination. The fifth type of depression is called postpartum depression. This type of depression is experienced by many women after giving birth when normal and physical changes occur within the body. The added responsibility of caring for the new one can also be overwhelming and lead to feelings of inadequacy in coping with this new role. Nearly 10 to 15% of women experience this kind of depression after giving birth. The sixth type of depression is very unique and is called seasonal affective disorder. This mainly occurs during the winter months when there is less natural sunlight. This kind of disorder can be effectively treated with light therapy, but in some cases, antidepressant drugs and psychotherapy may also be needed along with light therapy. Mental illness is a very commonly misused and narrow term used to describe a person with mental disorder. It is so easy to ignore the symptoms of mental illness. There is a list of emotions and moods commonly connected with the early stages of mental illness. But these symptoms are not an official test for diagnosing mental illness. Some common symptoms of mental illness are excessive worry or fear, depressed mood, confusion about your thoughts and feelings, suicidal leanings, unable to cope with stress, severe anxiety and insomnia, isolating oneself from family and friends, and paranoia. However, these symptoms are not unique to one particular kind of mental illness. Further, they are common among several different types of mental disorders. We should not let our stress, anxiety, or depression overwhelm us. We must take steps to fight the development of depressive disorders and mental sickness. Causes of depression: a combination of genetic, biological, environmental, and psychological factors is responsible for causing depression. Depressive disorders are also called illness of the brain. There are long-standing theories on depression that suggest that neurotransmitters or chemicals that brain cells use to communicate are imbalanced during depression. Brain imaging techniques such as MRI shows that the brains of people with depression look different from those without depression. The parts of brain involved in mood, thinking, sleep, appetite, and behavior appear different. But these images do not reveal why the depression occurred. Some types of depression are hereditary. However, they can also cause depression in families without any medical history. Scientists are striving to find certain genes that may make some people more prone to depression. Genetic research has shown that the risk for depression also occurs due to the influence of several genes acting along with environmental factors. The trauma of losing a loved one, a difficult relationship, or any other stressful situation can also trigger an attack of depression. How do children and teenagers experience depression? Children who develop depression are more likely to have these attacks as they enter adulthood. They are also more likely to have other severe illness in adulthood. A child who experiences depression may pretend to be sick, refuse to go to school, excessively cling to a parent, or worry that a parent may die. Older children become sulky, defiant, negative, and irritable. Since these signs are viewed as normal mood swings of children during their growth, it is difficult to accurately diagnose a young person with depression. Depression during the age of 15 to 20 is common and is accompanied by personal changes. Depression in adolescence occurs frequently along with disorders like anxiety, eating disorders, or even substance abuse. Some of them are inclined to commit suicide. A combination of medication and psychotherapy is the most effective treatment for adolescents with major depression. Women and depression. It has been seen that women are more prone to depression than men. Biological, hormonal, and psychosocial factors that influence women may be linked to higher depression rates among women. Some women experience postpartum depression after giving birth. A host of hormonal and physical changes are also responsible for causing this kind of depression. A severe form of premenstrual syndrome called PMDD or premenstrual dystopia is also seen among women. This is related to the hormonal changes that occur during ovulation and during menstruation. During menopause, some women experience an increased risk for depression. Osteoporosis or bone thinning, which occurs during menopause, also leads to depression. Many women also face the additional stress of work and home responsibilities, looking after young children and aged parents, abuse, and other relationship strains. How do men experience depression? Men are more likely to be very tired, irritable, and lose interest in day-to-day activities, also have difficulty in sleeping. Men are more likely to turn to alcohol or drugs to overcome the feeling of depression. They may become frustrated, angry, and sometimes abusive. Some men become workaholics to avoid talking about their feelings with family or friends. Some of them behave recklessly and even attempt suicide. How do older adults experience depression? Most senior people feel satisfied with their lives and free of family responsibilities despite having more physical problems which are normal part of aging. Depression in elders may be overlooked because they show very less obvious symptoms. Sometimes it is difficult to differentiate between grief and depression. Loss of a loved one leads to immense grief but generally does not require professional health treatment. Older people with depression improve when they receive treatment with an antidepressant and psychotherapy. Research has shown that a combination of medication and treatment are effective in treating depression in older people. Psychotherapy is particularly useful in combating minor depression among elders who are unwilling to take antidepressant medication. Remedies for depression. We have discussed earlier in detail about depression, its different forms, and the factors responsible for depression. Now we shall discuss the remedies or preventive measures that can be taken to avoid depression. Even the most severe cases of depression can be effectively treated if detected at the earliest. The first step is to consult a mental health specialist who is best equipped to treat this ailment. There are certain medication and medical conditions, such as thyroid disorder, which show the same symptoms. A specialist can rule out these possibilities by conducting a physical examination and a lab test. After these suspicions are cleared, the doctor will also do a psychological evaluation. The doctor may refer the patient to a more efficient mental health specialist who will do a more detailed and accurate evaluation of the family medical history to get a fair picture of your symptoms. The specialist will make a detailed assessment of your illness, the causes, and the duration of the symptoms and the type of treatment taken earlier. He or she may also inquire whether the patient is using alcohol or drugs and had past suicidal attempts, if any. When someone dear to us suffers from depression, it even affects us. The most important thing we can do is to help them get a proper diagnosis, followed by treatment. We must encourage them, give them moral and emotional support so that they may continue to take the treatment and also seek help if no improvement occurs within 6 to 8 weeks. We must talk to them and listen to their grievances and expression of feelings. We must never ignore their comments about suicide and report it to the specialists to avoid the occurrence of these incidents. We must assist them to take their medications correctly and on time and give them hope that they will recover soon. The treatments available are antidepressant medications, psychotherapy sessions, and the duration depends on the severity of the depression. We must not blame the person for their illness. Depression is a medical condition, and the person cannot help being affected by it. We should accept the person as he or she is and have only realistic expectations from them. They should not be made to feel that they are a failure or any less of an individual. They should be encouraged to do their daily activities independently. It is important to genuinely care for them and understand them. People with depression are often overwhelmed by irrational fear. It is necessary for us to be patient, persistent, and encouraging while supporting someone with depression. The person must be assured that he or she will not be abandoned. We should encourage the person to talk about their feelings, symptoms, and listen to their thoughts. We should let the person know that we are ready to listen to them when they are ready to talk. Listening must be done without being judgmental. The person may be speaking slowly or less clearly than usual, but we must be patient and supportive. We need to encourage them and give them hope that with proper treatment and with time, they will feel better and guide them on the road to recovery. Let us summarize the same. Depression is a kind of state that needs attention. If proper attention is not given in time, it affects the well-being of the person. In the first section of this video, we discussed what depression is and how to identify a depressed person. We also saw some concepts related to depression. In the second section, we discussed the signs and symptoms of depression. As we saw, many people describe depression as a state of being sad and lonely. Some symptoms are often left unnoticed, which then later becomes bigger problems. In the third section, we discuss the different forms of depression. There are many cases of unique depression. We learned about major depression disorder, dysthenic disorder, minor depression, psychotic depression, postpartum depression, and seasonal affective disorder. In the fourth section, we discussed about the causes of depression. We also saw how depression is caused in different stages of life. It is dependent on us to handle the same. We saw how children, teenagers, adults, men and women experience depression. In the fifth section, we learned the remedies that can be used to overcome depression. Life does not have to be always dark and sad for those who are in depression. Life is hard enough as it is. Treating depression can free up vital resources to cope with life's challenges effectively. When someone is depressed, it's not just the person in depression, but also all those around him who suffer with him. Providing treatment can bring hope to his life as well as to those people around him. Depression is a kind of illness. Given the right treatment, it disappears. We hope this session has brought to you a clear picture about depression in the family and how to tackle it. Hope you had an interesting session.